So today we've got Dr. Raina Palit, if I've said that correctly. And basically we want to really find out what dentistry dental school is like in 2022, what that experience is like, and what aspiring dentists can be looking forward to as they're applying to dental school, any tips that Dr. Raina can give us as well, and just finding out what she's about to step into. She's just freshly finished dental school and about to start a foundation year. So we'll be finding out all about that as well. So thank you, Dr. Raina, for being with us today.
Thank you so much for having me. I always have a great time filming with you, so it's great to be back on.
Fantastic. So just tell us a little bit about yourself. So you've just finished dental school, but just tell us a little bit about your background, where you went to dental school, and we'll get into it.
Yep, so my name's Raina. I went to Sheffield Dental School. I've recently just graduated, finished my 5 years at dental school, and my graduation ceremony was actually last week, which was amazing. It's the first year since COVID that the graduation ceremonies have happened on time, so that's been great. And yeah, so my next kind of stage of the journey is actually moving to London for foundation year. I'm really, really excited about that as well. But yeah, big step.
Gosh. So, all right, let's just take it back to you just getting into dentistry. Just to tell us a little bit about, what got you into pursuing dentistry as a career, and then just to summarize what that process was like for you.
Yep, so for me, my journey started at 18 years old. I came straight from sixth form college, did my A-levels, so I did maths, biology and chemistry at A-level, and I dropped economics at AS. And then I applied to Sheffield, Liverpool, Manchester and Newcastle dental schools, and I got interview offers from all four, and then offers from Manchester, Newcastle and Sheffield. And then in the end, I got my A-level grades and I decided to pick Sheffield as my firm choice for a number of reasons. Basically, it was the course for me, the amount of clinical experience that you get. That you start early clinical experience as well. So from second year, you actually make dentures for a patient, which was incredible, one of my favourite things. And then you have full body dissection as well, which is really unique. A lot of other dental schools don't actually do this. And as well as a elective in fourth year, so that's where you can go anywhere in the world and see dentistry there. So those are kind of the main reasons. Mainly the course wasn't too far from home for me. So I would say my journey was quite straightforward. Obviously no journey into dental school was straightforward, but I just kind of came straight from school, was very, very fortunate to get those offers, and then here we are 5 years later.
Gosh, no, that's a big thing though, getting all your interviews and then getting at least 3 acceptances from dental school. Just getting one is hard enough as it is. What would you say, looking back, helped you to stand out enough to get 4 interviews and to then get those 3 offers after interview?
Yeah, that's a really good question, actually. I think if I was to think about it, it's not just one thing. It will be a number of different things, I think. So I got a range of work experience, and this was at my own dental practice. I did a couple of days at a paediatric dental institute in Leeds, bit of max fax, an orthodontic placement, and also I went to a dental lab. So I did get a wide range of experience, and I think the way that I spoke about it in the personal statement and reflecting on these things perhaps was quite a strong point. As well as this, my UCAT score was quite good. I think it was 720 average, band 1, about that. So yeah, I was again very, very fortunate to get that score. In terms of sort of being well-rounded, as they like to see that you are, I did netball. I was secretary of my school council. I also did some volunteering at a secondary school and a care home as well. and I had a part-time job as well. So I think just a mixture of everything and just showing that I'm quite passionate and had the initiative to go and do things. Obviously, I appreciate that the past 2 years have been crazy with COVID, and this is a lot more experience than perhaps you'd get now. So this is something that I'm sure we'll speak about later on in the video.
Yeah, so actually we can get into some of that at the moment actually. So you were doing a lot, and when I was just hearing about the work experience placements that you got, I was just thinking, how did you manage to secure those? How did you even approach them to get the placements? And it was quite creative, the fact that you got work experience at the practice that you went to as well. So how did you approach that? And then after doing so much, how did you fit us all into the personal statement?
Yeah, so this is securing work experience is always a really, really tricky thing. So what I did was I wrote letters to the dental practices. Fortunately, my own dentist was, kind enough to let me come. We'd had a long relationship. He'd kind of seen me grow up, so he was very happy to take me on. I went every Saturday for a few months, just in the morning. So I kind of spaced that out and got that experience over a long period of time. With the other placements, I wrote the letters and just, fingers crossed, waited to hear back. Of course, this was about 6 years ago now, so things were a little bit easier to get those placements, but very, very fortunate to get them, and through my college as well. So our careers service was really good, and they had a placement week where all of the students actually had to find placements, and the college did a lot of liaising with these places. So that was where I got my orthodontic placement and my dental lab placement as well through there. So I would say, if you don't ask, you don't get. So definitely, ask these places, even if you think, because of COVID, you might not get it. Things are starting to open back up now. So I would say just go for it and, make the phone call or write the letter.
Yeah. One of the things I see a lot of applicants do, especially strong applicants who've had a lot of experiences like yourself, is they start to list all those experiences that they've had in their personal statement. So how did you stop yourself from just simply listing those experiences and present it in a good way in the personal statement?
Yeah, so firstly, it's a very good problem to have if you've got quite a lot of things that you want to talk about in the personal statement. So, well done if this is you watching that and you have lots of things to pick from. So what I did was I actually tried to focus on a specific experience within the placement that I had. So I mainly spoke about the general dental practice experience that I had. And I think I remember I spoke about an anxious young child who was examined on his mother's lap. And I was very, very specific about what I saw and exactly what I learned about communication and empathy and leadership skills, and then tried to apply this to myself. So I think as much as it's tempting to speak about everything, like you said, try and think about a really memorable moment that you had during your placement and speak about that in the personal statement.
Right. And how did you prepare for interviews? So, you said that you had a part-time job when you were still applying for dentistry. So I'm guessing that would have given you some confidence at interview. But did you do anything else to really help you prepare for interview, to be confident speaking to strangers? Yeah, how did you prepare for that?
Yeah, interviews are a really daunting one, actually. And like you said, with the part-time job, that was my first proper experience that I had in terms of interviews before. It was a very informal one, but it did give me some experience of, chatting to someone about my qualities and why I want the job, which is, at dental school, you would be asked why you want to go to that dental school. In terms of preparation, the main thing that I did was actually compile a list of questions. So kind of common interview questions like why dentistry, why this dental school, how have you got communication skills, leadership, etc., etc. Tell us about a time that you were in a difficult situation. And I actually bullet pointed answers to all of these on a document. And the few weeks leading up to my interviews, I think I had them from November to March, different interviews during those times, and I just went over this document and practiced really to myself. I do get quite nervous actually with other people, so I didn't really practice with any friends as such. And I know that's a very, very good tip, so I would recommend practicing with other people. But I actually just, did it in my room to the mirror and just hope that it came across okay. And also my college again, I really do have to thank them for all this. They did set up a mock MMI with the medics, so I did have that one kind of formal interview practice as well.
Yeah. Did you find that you got stronger with each interview you actually did go to in the end? How was that experience of attending the first interview and then your experience of attending the final interview?
Yeah, 100%. So my first interview was actually Manchester in November. It was about, I think, 3 or so weeks after I'd submitted my UCAS application. I really wasn't expecting it to come through, and I was like, gosh, I've not done any preparation. This is really the time to start doing that. So that was quite a rushed one, and it was quite a unique one back then. It had a bit of a group task. And yeah, so I don't know if they're still doing that, but that was quite interesting for me. And then I had Newcastle, very, very relaxed for me in January time, just kind of an informal chat. And then they showed you around the dental school, which was really nice. And yeah, by the time we got to Sheffield in March, sort of end of March time, I kind of had a bit of an idea of what was going on. I kind of knew which bits of, my whole application to focus on, my strengths. I also thought about a weakness. They like that question. And yeah, so I would agree, by the time I got to that last one, I did feel more relaxed and comfortable. And, I ended up at Sheffield, so I guess that says something.
No, that's awesome. That's awesome. I just wanted to take it now to the dental school experience, because you're still freshly coming out of dental school. And I know things have changed since you started dental school and as you're leaving dental school. So can we just talk to that? How was dental school when you started? And then when the pandemic happened, how did it change? And then now that the pandemic's been 2 or so years ago, how are things coming along now? So yeah, just talk us through from year 1 to 5 how things at dental school have been.
Yep, so when I started dental school, I was like any other bright-eyed teenager. I was really ready to go. I was looking forward to it, very excited to move in with, a bunch of new people into a flat in accommodation that I didn't know about. It was quite a normal start to university. There was Freshers Week, we went out, I met my whole year and settled in, started to go to lectures, take notes. It was very, kind of the way that I thought the university experience would be. And then obviously the big shock to the system was the amount of content at dental school. I think in that first sort of semester, which is half of the year, there was about 150 or so lectures, which I just wasn't used to processing that amount of information. So I very quickly had to find a note-taking system and a way to kind of capture all of this information that would work for me for exams. And then kind of moving on from there, I've settled in, I've started to do a bit of introduction to clinics. I'm finding my feet, I don't feel homesick anymore. And second year was a really, really good year actually for me. There was exams at the end of the year, but not in the middle of the year, like first year. So I had a bit of a break, which was nice. And then third year, unfortunately, I only did half of third year really, because the pandemic was kind of March time of third year for me. And I just done my hardest set of exams in dental school. So I didn't get out of those. I did do my human body exams, all of the organs and diseases and everything. And then they basically told us to go home. And I was just like, okay, we'll be home for a week and then we'll come back. It'll be fine. It's just like a mini holiday, we'll just ride it out. And we just didn't come back till fourth year. I think they did bring us back very towards the end of third year just to try and catch up, but it was mainly fourth year that we came back. And from then on, it was just kind of non-stop. And obviously for COVID, as we've all experienced, it kind of, made us fall behind in some aspects. So with dentistry, it's a very hands-on course. You need to constantly be doing practice. And so they had to find hours for us to make up all of the sort of clinical practice in the phantom head lab that we'd missed. And then they were obviously really busy with the year above. So, getting them through, getting them to foundation year, and we were worried that maybe we'd been forgotten about, but it was kind of a backlog as they worked through every year. And they did a fantastic job. I'm incredibly lucky that Sheffield still gave us outreach. So outreach is actually a few weeks in a dental practice working as basically a proper dentist with your own list. You still have a supervisor, but it's your first kind of taste of the real world, and Sheffield still managed to organise this for us, even during the pandemic. So that was my first kind of experience, and I think that's really when I realised, okay, I think I can do this job. I think I like it, and I think I can do this job. And then fifth year was a whole of the kettle of fish. Right from September, you're thinking about applying for foundation year. So you've got your situational judgment test around November, the interviews were January. And in and amongst that, clinics every day, revising for finals, which is basically all 5 years of content, and also revising for vivas. So vivas are kind of oral exams with unseen cases, and they give you, a patient case and tell you, right, what's your treatment plan? Go. So this was, again, very new. Fifth year was a lot of new experiences, similar to first year. So I think first and fifth year for me were kind of in parallel because of the amount of new experiences that I had between them. I think the other years were, clinics and lectures as expected, but those 2 years were very pivotal for me.
Tell us a little bit about, if you still remember, the first patient that you treated as a student.
Yeah.
And then maybe something memorable in terms of a patient that you saw through treatment in final year.
Yep, so the first patient that I treated was the dentures patient in second year. This was the start of second year, and you have a tutor that takes you through this kind of, I think it's 6-week course where you make a set of dentures start to finish for a patient. You do the clinical stages, not the lab stages. But it was the first time that I'd properly interacted with the patient, and it was just so lovely. Like, I had the sweetest old woman, and she was just so grateful, and it was a really, really nice first experience, because I just thought, if all patients are like this, then I'm sorted, really. And yeah, that was just, I can't remember specifics about that, but I just know it was a very, very good interaction and just a very positive one, and I'll always remember it like that. In terms of other memorable patients, I've had a few. To be honest, all of my patients have been incredible, like so lovely, have let me do, all the treatment that they need, been very cooperative, shown up to appointments as well. There was one patient who I made a set of cobalt chrome dentures for, upper and lower, and she'd been actually, because of the pandemic, she'd been waiting for ages with a very badly fitting temporary denture. So by the time she came to me, she was really keen to get going with this denture, and the end of that treatment, she was just so grateful. She got me a thank you card. And yeah, that was my first sort of thank you card from a patient. It was really, really nice.
Gosh. And if you were looking back to your first experiences of clinical dentistry on patients to now, how would you say you've developed?
So for starters, I'm a little bit less nervous. When I first started, I was just kind of, I think, afraid of just saying the wrong thing or not being able to explain something in the treatment plan, or, not being able to get informed consent properly. I think these are kind of the things that you're thinking about. Is this patient going to like me? Do I know what I need to know? But now I think because I've developed that sort of base level of knowledge, I've still got 1,000 more things to learn, but I've got that base level of knowledge, and I've got something that I can fall back on. And I know that if I've always been told by tutors, everyone through dental school, if patients like you, that's kind of the first step, and that's the main thing. So try and develop that rapport, get to know who they are, ask them about their day. And I got more confident at doing that from my first exposure with patients, is actually remembering that they're human, remembering that you've got a relationship with them in that capacity, and then going from there.
Yeah. And I mean, the experience of dental school is going to be different now, like you were saying, from when you first got into dental school. From what you're seeing, what sort of things can first years expect when they start at somewhere like Sheffield?
Yeah, so in first year, expect a lot of lectures at Sheffield. So Sheffield is traditional teaching, which means you've got a lecturer stood at the front of a lecture theatre giving you a presentation with their slides. You'll be there, sat down, taking notes, either handwritten or on a laptop. So expect to be in for quite a few hours a week doing that. And then as you kind of start from that, you'll start doing dissection as well, so full body dissection. And that was, again, I really thoroughly enjoyed dissection. A lot of my friends didn't. I think the main consensus is dissection wasn't that great for everyone, but I thoroughly enjoyed it. Really lucky to be able to get that experience, and it being full body as well, so not just prosection, which is just an organ dissected. And that's kind of the first sort of, I guess, display of your manual dexterity. And then you get to go to the Phantom Head Lab, where you get taught the dental instruments, tooth morphology, how you should sit, how to work with the nurse, all of those kind of basics, how to chart as well. So you'll get really good at knowing all of these things, and then you'll be able to assist the older years as well. So that's where you really kind of start to get some experience of what kind of treatments a dentist can do, and also see the older years interacting with their patients as well. And I found that really helpful. Sometimes, people kind of do begrudge going in to assisting sessions, but genuinely, thinking back on it, that was really, really helpful to know what to expect from then on as well. And you do also, chart each other's teeth. I think we took impressions of each other's teeth. And then in second year, when you're doing anaesthesia, we practiced on each other as well, and practiced local anaesthetic. So you do get exposed to all of these things as you go along.
Yeah. Do you think that the level of clinical experience is going to get back to the normal levels at this stage, or do you still think that the level of clinical experience is going to be less because of all that happened with the pandemic?
Yeah, that's a really good question. I would say, just from my own experiences and what I've seen in the past 6 months, I felt like we were basically back to normal. And I don't know if that's because, obviously, being in fifth year, they need you to get up to a certain level and be competent enough. And they were really giving us those clinics every day, and to get our targets as well. But I would say, hopefully it's been just over two and a half years now since it all started. And the dental school tried to get us back in as soon as they could, really, in a safe way. And yeah, I'd say now it feels like the capacity will be back there. Obviously, people are still going to get COVID. There's still going to be issues with that and being off sick and things, and tutors not being there. But hopefully from now on, with the vaccination scheme and everything, it should be back to normal.
Yeah, that's good to hear. It sounds like you've always had some form of part-time job at each stage. So before you got into dental school, there was a part-time job. When you were in dental school, part-time job, and different things that you were getting involved with. And even now, I was trying to get a hold of you. We had to jiggle things around your part-time job. So have you always been like that? Always wanting to get something on the side to have that freedom and independence?
Yeah, I would say I have always been seeking that independence. And I started, I think, working from the age of 14. I think it was like my first part-time job. I worked in like a post office, a cafe, things like that. And it's just kind of always been a part of what I wanted to do. So there's a number of reasons for it. The skills that you get from part-time work are obviously incredible, like time management, leadership, working in a team is the main one. Obviously the money that you get on the side is great. Being at university, it's a huge financial burden, so having a part-time job definitely helps support that. And also one of the biggest ones that I found for me at Sheffield is actually the friends that you make through a part-time job. So because I've done various different jobs, I've worked for the Students' Union, I've done some work with widening participation, online work, social media. I've got to know a lot of people, and I think that's kind of the biggest thing that I would say to someone else is to try and, get a wide range of experiences and meet other people, because you just never know what opportunity lies behind that door and what other people can offer you as well. So yeah, I would say that's those are the reasons why I've always had a part-time job.
Tell us a little bit about some of these other opportunities that you've had within dental school. So you've collaborated with Dental Protection, Medify. How have all these things come about whilst you're studying and in dental school?
Yeah, so these things really only came about in the past couple of years since I started my YouTube channel. That's been a little bit redundant in the past year just because of fifth year being so hectic, but I'm really hoping to get that back up and running during foundation year. And I never thought when I started that channel that I would be getting all these other opportunities off the back of it. I really just started it because of a few reasons. I was bored. I was, looking for something else to do. I wanted to utilise the skills and the knowledge that I'd got up until that point, and I thought, what better way to do that than help other dental applicants, try and create valuable content and resources for them. And the best part of it is, YouTube is a free platform. You can watch anyone's content for free, and that really appealed to me, because when I applied to dental school, I didn't watch anyone's dental school vlogs. I didn't really know that dentistry was on social media and that dentists had platforms. I definitely didn't follow anyone that was dental related. All of my family are medics, so I didn't really have much information about dentistry. So I think that was one of the reasons why I wanted to do it. There was a space for that. There's a lot of medical student YouTubers and content creators, but there's not really that many dental content creators. And yeah, so in terms of opportunities, I kind of realised as the channel grew, then companies and people started coming to me with things that I really wanted to be a part of. For example, Medify. I used Medify myself when I applied to dental school and to revise for my UCAT, and I was obviously going to say yes to that. They're a great company, and I wanted to be a part of that. And it's the same with Dental Protection. I've always been a member with them throughout dental school, so when they wanted to work with me again, I said yes. So it's just about kind of, I guess, saying yes to the opportunities that you've got and also meeting people along the way. And you never know what's going to happen.
And how did you manage to fit that all in with everything else? Was it actually making you end up having to spend late nights revising whilst also trying to handle all these opportunities? How did you juggle it all?
Yeah, so I'm not going to lie, when I first started the YouTube channel, and you'll know this as well, editing takes a long time. It takes many hours. I didn't quite realise how many hours, I'd spend probably 10 to 12 hours, maybe more, on a single video. And inevitably, that is a lot of amount of time to spend, and sometimes I would miss out doing things with my friends. But I kind of believed in the channel, and I knew that I did. If I kind of put the work into it now, that hopefully, there would be some sort of, opportunities, or, people would keep benefiting from this channel. So I did put a lot of work into it in the kind of first couple of years that it was on. At the moment, I just couldn't quite find the right balance with it with finals. That was a whole nother situation because there was just so much on my plate. But obviously, you need to prioritise certain things at certain points in your life. So in terms of time management, I would try and do, like, at the weekends, if I had a free Saturday, free Sunday, I would try and just complete the whole project, complete the whole video, and sort of leave the other evenings free if I wanted to kind of go for dinner, see my friends, watch TV with my housemates. I did try and sort of work around other things that I wanted to do as well as dental school. So one of the key benefits, I think, during the pandemic was online lectures. So that really allowed me to tailor my schedule to doing all of this. And I was very fortunate at that time that it was mainly all online. I'd say that was one of the big reasons why I could manage it as well. But yeah, I think now going forward, obviously I'm going to be working full time as a foundation dentist, so I'm going to have to really look at my schedule and block out time if I want to do videos and keep creating.
Yeah. So tell us about that foundation, the foundation year. So just for those that are not aware of what it is, what's the foundation year, and just tell us about how you end up getting a practice to work at, and all the different things you've got to do to prepare for that.
So the foundation year is 1 year of training in an NHS dental practice, and it's a year that you're required to do if you want to get on the performer list. So if you ever want to do NHS work in the future, you have to do this 1 year of foundation training. It's 1 year after you do your 5 years, and you apply for it in 5th year. And it's the applications made up of the situational judgment test, which for me was 75%, and the interview, which was 25%. Now, actually, I saw for the next year it's going to be entirely situational judgment, so there's not going to be an interview. And the process started, I think, from September when you first sort of open your account. And then you have the situational judgment test in November. I did a few weeks of practice for that. And then in January, the interview. And then we had to preference all the sort of regions in the country. I think there was about 66 regions that the whole sort of UK is split into, and you have to preference them 1 to 66 or so. And then you get allocated to a certain scheme. So I got North West London, and once you've got the scheme, then you have to again rank the practices within that scheme. So there were 15 practices, I believe, for North West London. So I ranked them 1 to 15. And then you get a choice after that. So it's a really long process over the whole year, and you apply on this system called Oriole. They keep sending you emails throughout the whole year to remind you what stage of the application you're at. And then you start foundation training 1st of September. So yeah, at the moment I'm going through a lot of forms, a lot of admin that's really boring, and I'm trying not to miss any emails to get all my kind of job set up for September.
Yeah, and what would you say you're looking forward to when you start at this practice? What are you looking forward to?
I guess I'm really looking forward to building upon the skills that I've already developed in 5th year, getting more confident, getting up to seeing a decent number of patients in a day. I think that's the thing that's making me a little bit worried now, because in dental school you only really see 2 to 3 patients maximum in a session, so in a morning or an afternoon. Most people just see 1, whereas in a dental practice you'll be seeing probably 15, 20 patients, and then after that you'll be working up to more patients a day on the NHS. So that's something that I'm going to have to get used to. I hope I'm going to be eased into that slowly. And yeah, I'm just looking forward to meeting my educational supervisors as well. So they're the people that will be on hand if you have any issues. They're also dentists that work in the practice most of the time full time, and they're going to be there if you've got any problems or need some help and guidance. And they also see that various points in the year that you're meeting targets and that your skills are fine, and you can progress to the next stage as well.
Yeah. And do you know if you're going to have study days scheduled? You're going to get to meet everybody else that's on your scheme. Has that all been arranged yet?
Yeah, so it's not been formally arranged yet, but one of the reasons I applied to London was I heard that the study days are really good, and I think they're all mainly in person, which is great. Sort of hands-on courses on phantom heads. We've not been given the schedule for this yet, but I'm looking forward to when it comes through. And we've got a group chat with the rest of the people in my scheme as well, so we've been getting to know each other through there.
Yeah, and you said this is the 1st of September. That's your first day at clinic.
Yeah, so it's a little bit strange because it's always 1st of September, no matter what the day is, I believe, and I think it's a Thursday for me this year, so you just start whenever it's the 1st of September.
Yeah. And are you expecting to start treating patients on that very day? Do you know what you're really expecting?
I hope not. No, I think the first day is probably, again, form filling, inductions, being shown around the practice. I don't know if, it'll be the full day, the morning. I heard from a friend last year as well. She did a bit of phantom head work in the beginning as well. So, so far I've got absolutely no idea what it's going to be, but I'm hoping it's not a full list on the first day.
No, I'm sure it'll be inductions, introduction. I think for me it was a week. It was a week of just getting introduced to everything, and then the following week we started seeing some patients. And I got to have full control over the books, so I could book as many people or as few people as I wanted, how long I needed for them. So I'm sure you will have
that's
freedom.
Good, yeah. That's really reassuring, thank you.
But I'd like to just ask you, if you were to speak to your younger self who was applying to dental school, what piece of advice would you give yourself? What encouragement would you give yourself? Talking to younger Raina, what would you be saying?
I would say, don't be afraid to put yourself out there. Dental school, it's still a school environment, and there's still other people around you, and you can still feel, whether if people are judging you, that kind of thing. So I'd say, if you want to do something and you want to put yourself out there, go for it. And you just never know what kind of opportunities that you might open yourself up to. Go to things like the, BDSA, sports day weekends, the conferences, any kind of events that are happening in dental school. Go to them, because you meet so many people from other dental schools. So I'm actually, moving in with a friend that I met through one of these kinds of events now. So you can expand your network and actually meet other dental students, which is great. And then when you go to those cities, you've got people that you know and people that can support you as well. So yeah, I'd say my main sort of piece of advice is, don't worry about what people think. Do the things you want to do. If you want to do extra reading, if you want to go to that conference, if you want to be a bit nerdy, it's fine. Just do what you want to do. For example, this year in April, 2 weeks before my finals, I went on a trip to Belgium with King's Aesthetic Dental Society, and we did this whole composite course, and no one else went with me. I was the only one from Sheffield. I was a bit nervous, I turned up to London by myself. I didn't really know anyone there, and I met some incredible people, 2 girls from Cardiff that are now my friends. I went to see them. So yeah, just put yourself out there. Don't be worried about other people, and yeah, you never know who you're going to meet and what you're going to do.
Awesome. No, thank you so much for taking this time to be with us and to share your experiences and all that's been happening with your dental journey. Where can people get to connect with you if they want to find out what you're up to or ask you any questions?
Yeah, of course. So I am on Instagram. It's at Raina on the Cusp. I'm very active on there. So if you send me a message, I'm more than likely going to see it. You can email me as well if you fancy, if it's a bit more formal. That's rainaonthecusp@gmail.com. But yeah, Instagram, best way to get in contact.
Right. No, thank you for that. And guys, do make sure to check out Raina on her different platforms. And thank you again for being with us. And
thank you so much for having me.